Okay guys, today on DrVet we're talking about eyes. Healthy eyes and unhealthy eyes. Stay with me and I tell you all about it, about the most common conditions we see in veterinary practice. If your dog's eye suddenly looks red, and if your cat keeps squinting, if there's discharge, watering or swelling, most owners say one thing: it will probably clear up. But here's the truth: eye problems are never something to ignore. Some are mild, some are uncomfortable, and some can cause permanent damage in just hours. The problem is, many eye conditions look very similar at first. Today on DrVet, I'll show you the most common eye problems in dogs and cats, what you can safely do at home, and exactly when the eye problems become emergencies. Because with eyes, waiting can cost vision. Let's start with something important. Eyes heal quickly, but they also deteriorate quickly. The surface of the eye is one of the most delicate tissue in the body. Small problems can worsen fast, especially if rubbed, infected or left untreated. That's why the eye issue always deserves respect. And why let's wait and see, it's often the wrong approach. Let's talk about conjunctivitis. This is inflammation of the tissue around the eye and eyelids. It's extremely common. Signs include redness, swelling, discharge, sticky eyes, or squinting. Conjunctivitis is not a diagnosis by itself, it's a reaction. It can be caused by allergies, infection, foreign bodies, dry eye, or blocked tear ducts. Here's the key message: treating conjunctivitis without finding the cause often leads to repeat episodes. Watery eyes are often dismissed. He just has runny eyes, she always tears up. But excessive tearing is a sign. Possible causes include mild irritation, blocked tear ducts, allergies, eye shape issues, foreign material, or early infection. Tear staining isn't just cosmetic. When tear sits on fur, they irritate the skin, they trap bacteria, they cause secondary infections. This is where the gentle daily care makes a massive difference. Now let's talk about the dry eye. It's often misunderstood. Dry eye means the eye doesn't produce enough tears. Signs include thick discharge, red eyes, dull or cloudy appearance, frequent blinking, or the eye infections that keep returning. Owners often think the eye looks wet because of discharge, but this discharge is not lubrication. Dry eye is painful. It is not something that improves on its own. Early treatment protects vision. Late treatment becomes lifelong management. Another eye condition seen all the time in veterinary practice is cherry eye, also known as a Nictitans gland prolapse. So when we've got the eye, right, eye corner, this is basically gland which is popping in the corner of the eye, very often seen as a big red blob. At first irritates the patient quite a bit, and as the time goes by it's getting easier. However, it's very unlikely that the gland like this is going to pop in and stays there. Sometimes it's reduced but it's popping out again. So in majority of cases, this medical condition needs vet attention because we need to do something about it. We may treat the problem, help maybe reduce the size of the gland with some drops. It's usually not very effective. Or we can operate on a patient, which basically means what we can do, we can pocket this gland in, we can create a little pocket and put it back to the right place, or we can remove the gland, depending on the situation. Don't wait too long. When you see condition like this, don't be scared. It's not an emergency, it's not a tumor, it's not something terrible. However, see your vet, because this kind of irritation can lead to the further complications, can causing of the conjunctivitis, it can lead to the corneal ulceration, as the pet keeps rubbing the eye. Cherry eye looks dramatic. A red round swelling in the corner of the eye is common in young dogs, rare in cats. This is not infection, it's not a tumor, it's a tear gland that has moved out of position. Important rule: do not try to push it back, do not rub it, and do not ignore it. Cherry eye often needs veterinary treatment to protect long-term tear production. The sooner it's assessed, the better the outcome. In first opinion practice, Corneal ulceration is one of the most dangerous conditions because the pet can simply lose the eye. So we have to act quickly. So always remember to bring your pet to the vets if you think that the eye looks odd or is cloudy, or your pet is squinting quite a lot. That means that it must be seen by a vet, because as quick as we see it, as quick we can do something about it. So remember, the cornea is the transparent part of the eye, is built from the 4 layers. So you've got 1, 2, 3 and 4 anatomical layers. And remember that depending how deep the ulcer is it the first layer, second layer or third layer, that determine how long it's going to take for the ulcer to heal. If the 4 layers are affected, this is dangerous, and this is the point where the eye may be beyond saving. So just be aware about it. Don't wait too long, because that will be a horrendous problem and we may not be able to help.
This is one of the most important sections. A corneal ulcer is a scratch or defect on the surface of the eye. They are painful and they worsen fast. Signs include sudden squinting, eye closed, tearing, pawing at the face, or cloudiness. Here's a rule: if an eye is cloud or squinting, it is emergency. Never use leftover drops, never use human eye medication, and never wait. Ulcers needs proper diagnosis and correct treatment. Now let's talk about what you can safely do at home. This is first aid only, appropriate for mild discharge, slight redness, watery eyes, dust or pollen exposure. Safe home care includes gentle clean eyes 2 or 3 times daily. Use sterile saline solution or cold boiled water. Always use separate cotton pads for each eye. Wipe from inner corner outwards. Trim fur around the eyes if safe to do so. Wipe tear stains before they dry and harden. Keep the eye clean and dry.
Please remember, there are different medical conditions. You can actually deal with them at home. Some of the veterinary products you can buy easily off the internet, like Opticare, or for example, Rement corneal repair gel. But one thing though, remember, I'm not encouraging you to treat your animals on your own, because that can lead to the fatal mistake. You can buy those products, however, you should see the vet first and then determine what kind of condition your dog's cat has, and based on that, choose the product. Don't choose the product because the doctor Google told you. Do not do that. Don't use AI to diagnose your dog, because it's also wrong. Remember, see your vet, and if your vet gives you green light, buy the product online. Always see the vet, because your pet may lose the eye.
If your pet rubs the eye, use the cone if needed. This prevents damage while you're monitoring progress. And do not use human eye drops. Use the herbal or internet remedies. Use old prescriptions or touch the eye directly. If there's no improvement within 24 hours or things worsen, that's the clue you need to see the vet. When eye problems are an emergency, see a vet urgently if you notice eye closed or squinting, sudden swelling, blue or cloudy eye, blood, severe pain or rapid deterioration, especially after trauma, cat fight, roof play or foreign bodies. With eyes, early treatment saves vision. Delay risks permanent damage. Eye problems are scary, but many start small and many can be managed well if caught early. Your job as an owner is not to diagnose, it's to notice, clean gently, and act when needed. If this episode helped you, please like it. Subscribe to DrVet for clear, honest veterinary advice, and comment below, have you ever dealt with the eye problem in your pet? Next episode on DrVet, we're talking about something that worries owners instantly: coughing. Is it serious? Is it heart related? Is it infectious? Can it be resolved at home? And when does coughing mean you need to see the vet urgently? Because not all coughs are the same, and some should never be ignored. I'm DrVet. I'm helping you to help your pet. I'll see you next time.